Hi, my name is Molly Forder and I'm a graduate nursing student here at Auburn University. Today I'm going to be talking about penicillins. I know I didn't just say throw a pin to the ceiling, but now that I have your attention, let's learn a little bit more about this drug class. So they're divided into categories based on the spectrum of their activity. We have penicillin G, the anti-staphylococcals, penicillin V, and your broad spectrum penicillins. They're listed for you here. The action of penicillins is that they bind to the protein responsible for cell wall synthesis of the bacteria. And if the bacteria aren't able to synthesize, then they die off, and you have decreased signs and symptoms of bacterial infections. The therapeutic effects of penicillins is extended spectrum because they both kill the bacteria and prevent bacterial growth. Pharmacodynamics is time-dependent killing. This means that the killing ability of the penicillin is dependent upon the concentration within the system. More penicillin, more bacterial killing; less penicillin, they may not be able to kill all the bacteria that you need them to. Absorption. It's absorbed in the GI tract, and penicillin G is the most sensitive, so you want to make sure to give it 1 to 2 hours before or after eating, whereas amoxicillin isn't affected by food or drink at all. Distribution. It's distributed rather quickly, and in the sign of inflammation, it's distributed even more quick. Metabolism, it's mainly renal, but you have some that are hepatic. The half-life of penicillins vary from one to another, but they're all within 1 hour, so they have a relatively quick half-life. The excretion is in the urine, 58 to 85%. Precautions you want to use cautiously in your renal impaired patient, a patient who is on a sodium restriction, who has mononucleosis because they can get a bad rash, and if they have an atopic predisposition such as asthma. Contraindications. Really the only contraindication is if you have a previous hypersensitivity reaction, although 9 out of 10 people who report being allergic to a penicillin do not truly have an allergy to penicillins. Adverse drug reactions: nausea, vomiting, diarrhea, rash. Those are the main ones. Although you can still have sore throat, sore tongue, vaginal itching, vaginal discharge, white patches in your mouth, white patches in your throat, headache. More severe reactions would be affecting your breathing, shortness of breath, fever, joint pain, lightheadedness, feeling like you're going to faint, puffy or swollen face, red scaly skin, anemia, thrombocytopenia, and seizures. Drug interactions: if you're taking methotrexate, the only one you can take it is amoxicillin, whereas allopurinol, you can't take any penicillins. Indications for clinical use: only for bacterial infections. Don't use for your common cold, flu, viral infections. Penicillin G is most effective for gram-positive, gram-negative foci, gram-positive rods, and anaerobes, whereas broad-spectrum penicillins affect gram-negative bacilli. Rational drug selection. So ampicillin is preferred, or amoxicillin is preferred over ampicillin because amoxicillin is absorbed better, you have less GI side effects, and you don't have to give it as frequently. These last 3 down here: carbonicillin, ticaricillin, piperacillin, use cautiously in your patient who has a history of bleeding. Carbonicillin and ticaricillin, cautious in your patient who has CHF or hypertension because they have the highest salt content. Piperacillin, cautiously in your patient who has cystic fibrosis. Amoxicillin, cautious in your patient who has PKU because it has aspartame. Amoxicillin, ampicillin, penicillin V, they affect the benefits of birth control, or the effectiveness of birth control, and so you want to make sure that your patient is on 2 forms of birth control if they're on one of those 3 medications. Monitoring. You want to monitor cultural insensitivity, signs and symptoms of infection, diarrhea, rash, CBC, urinalysis, bone, creatinine, AST, ALT, liver function test. In a diabetic patient, they may have false sugar tests because of the penicillins. Patient education: you want to educate for most of them to take on an empty stomach with a full glass of water. That means 1 to 2 hours before or after food. Although with amoxicillin and penicillin V, it doesn't matter if they're taking it on a full or empty stomach. With penicillin G, you don't want to take any fruit juices or anything acidic. And finally, if they miss a dose, you want to take it as soon as possible, unless it's so close to your next dose that you would be doubling your dose because you don't want to double your dose. So in that case, you would just skip that dose. Lifestyle management, you want to educate on good hand washing technique, good hand hygiene habits, and encourage them maybe to take a probiotic. And for my final takeaways, ding, 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 if you haven't heard anything else throughout this video, pay attention to these key points. I'm going to throw some pins at the ceiling so you can remember them. Main takeaway number 1 is that penicillins kill bacteria by inhibiting cell wall synthesis. Main takeaway number 2, you do not want to give to a patient for cold, flu, other viral infection. Only give penicillin if you are sure they have a bacterial infection. Main takeaway number 3, you don't want to give to a patient who has mono, and keep in mind when we went over all these penicillins down here, the other diseases you want to keep in mind and be cautious about. Main takeaway number 4, if a patient only has a rash to penicillin, you can still give them a cephalosporin and they should be just fine.